Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. If you have not had a chance yet to subscribe, I would very much appreciate you subscribing to the channel. Not only it helps algorithm to help other people find my content, but it also helps me and helps the channel grow. So I would really appreciate you videos to watch, subscribe, and also comment below. And if you have been doing that for a number of years now, I am greatly appreciated. For today's video, I want to talk to you about the problem that I see and has been seeing going on for a number of years now with overemphasizing specifically surgical transition. I am not talking about medical. By medical, I'm referring to hormones. I'm talking about overemphasizing surgical transition and the problems that I see that people experiencing when they fall in the trap of overemphasizing surgical transition, and especially overemphasizing what surgical outcomes are going to give them. Before I start, super clear, and I think all of you by now already know this about me. Without a doubt, surgical gender-affirming care is life-saving care. Without a doubt, I believe that surgical gender-affirming care it's a health right, and it has to be accessible to all adults. I work with adults. So I will support anybody who decides for numerous personal reasons to step into surgical gender transition. And I have seen firsthand how incredibly beneficial it is in not only reducing gender dysphoria, but making one feel more aligned to their gender and making one move forward and be liberated of gender dysphoria. So by no means is this video intended to be, I hate that word, gatekeeping. However, we also have to talk about the not falling into the trap of overemphasizing the importance of surgical transition. Now, without a doubt, for a lot of individuals who struggle, especially with physical gender dysphoria, especially when they have very severe symptoms, even moderate symptoms, as a response to it, without a doubt, consideration for gender-affirming surgery is going to be really important. But I find myself also witnessing in today's world, and especially on social media, so much overemphasis on not only gender-affirming surgeries as sometimes being presented as if once you have gender-affirming surgery, and this is what I really most importantly want to talk about, once you have gender-affirming surgery and you have that physical alignment, suddenly poof, everything goes away and you're happy. Another thing that I disagree with is I see this presentation, two things. I see on one hand this presentation that gender-affirming surgeries will give you this amazing, surreal results where you're going to completely fall in love with your body. And that does happen for a lot of individuals. The reality is that there's a lot of people who don't get those results, and we don't really get to hear them. It doesn't mean that they're not happier stepping into gender-affirming care. Again, it just means that results vary drastically across individuals. Another thing that I disagree with, to the second one, is I disagree with this narrative that, especially for trans women, you're not valid, or you're not transgender, or you're not trans, and you should not be using the terminology unless you're going through surgical transition. And if you're not going through surgical transition, then you're not transgender, and you need to just move along or get off or come join our club when you're ready to go through surgeries. And that type of narrative, actually quite a bit of gatekeeping narrative, does a lot of damage, because on one hand, it is very exclusionary. It doesn't acknowledge a lot of trans women who can get surgery, who can afford to get surgery, or most importantly, who don't feel like particular gender affirming surgery is for them. They don't have a need to align a particular part of their body, or they don't even see certain aspects of their physicality or secondary sex characteristics as being in disalignment with how they see themselves. So it perpetuates this idea. It also perpetuates ideas that there's only one way to be a trans woman. And the way to be a trans woman is to fall in line with a binary idea of woman. This is also where so many individuals struggle with this high idealized view of passing, and also struggle with starting to desire cis passing, or starting to desire to be seen as cis women. And all of this narrative that is happening starts to create unhealthy expectations. When you are starting on a gender path, you're starting on taking little steps to feel more congruent with yourself. Of course, surgery is going to cross your mind, not only because it's a viable option, but also because, as you know, a lot of you do struggle with a physical disalignment, and that physical disalignment can't just be fixed with hormones. It can be just fixed with modifying how you present yourself or how you look. A lot of it has to be modified with surgery, and so surgery is going to cross your mind. When you're then also being presented with a lot of social narrative out there that surgery will solve your problems and surgery is going to give you this amazing body and surgery is suddenly going to make all of the dysphoria go away, or when you also get into that narrative that surgery turns out really well for everybody, well, you create certain set of expectations for yourself. The reality is that each one of you is different. People always ask me, will I get all of the results that I want from stepping into feminizing hormones? The truth is, nobody knows. People always ask me, will I feel fully aligned and happy when I get this and this and this surgery? Nobody knows. But when you're putting a lot of expectations on that as making you happy, chances are you're already going to lose. And you're already going to lose because, in my experience, gender transition is not just medical and surgical. Gender transition is as much an internal process as it is an external one. I have seen so many individuals who have gone through surgeries and who are beautiful, fantastic surgical results, who are miserable and unhappy. Why? If this was meant to solve all of their problems, if this was meant to make them feel, why? Part of it is that there's no internal integration that took place. All of this has been external, but now guess what? You have to internalize your sense of identity. You have to internalize and work through your own aspects of it. You have to detox internalized transphobia. You have to reshift the way you navigate the world. All of those things have to happen. Now, of course, there's a lot of individuals who are happy and have fantastic outcomes, and that's great. But it's important to remember that anytime you overemphasize one element of gender transition over everything else, you're setting yourself up for challenges, and you're setting yourself up for a disappointment. Again, transition is a holistic aspect. You're not only changing externally, but you're also changing internally. You may also not change externally as much because you have your own foundation basis, which include not only your genetics, but also include your age, your way to recover from surgeries, your way of, there's so many factors that go into that foundation. And as a result, the results are going to be very, very different for you, but they're going to be your results. So when you're overemphasizing surgery because you're overemphasizing based on witnessing somebody else's results, you're selling yourself short because by doing so, you're disacknowledging your own blueprint and you fall prey to somebody else's blueprint. And that's not how it works. And so I have seen again, I have also seen people who sadly had gender affirming surgeries, even with the best doctors, and have things where things didn't work out the best way. Had, for example, where the function was not very present, or sensitivity wasn't very intact, or other issues may have come to the surface. And people were really devastated, and people were very crushed because they were really feeling like this is going to be it. This is going to be it. Once I do this, once I go through this, this is it. This is it. It is it. I'll be so, so happy. And then I can just work on everything else. And while for a lot of people, gender affirming surgery, for a lot of adults, does carry fantastic and great results, and people do really well. And again, I don't want to make it sound like you should not have gender affirming surgery. Of course not. You do what you need to do, what you have decided will be best for you. What I'm saying about is don't not do it. What I'm saying is don't overemphasize the significance of it. Don't overemphasize significance of surgery above everything else. Because you still have the whole life ahead of you. And as you age, your body's going to age. Again, with surgery, you don't know how chips are going to fall. You're going to have to rediscover a new way of relating to your body, a new way to relating to yourself. As I said, I have seen the most beautiful individuals who have transitioned and look amazing and still struggle with imposter syndrome. Why? Why would you struggle with imposter syndrome if you look so beautiful? Why would you still struggle with all of this internal self-loathing, self-critical, internalized transphobia where you hate yourself? Because the internal process has not taken place. Because a lot of emphasis has gone on external. And sadly, this is a problem of our society. This is a problem of transgender community, because they're also culprits at overemphasizing the surgery, right? Overemphasizing the physical, right? Look at the Instagram. If you're beautiful, if you're useful, this is the whole cosmetic beauty, beauty industry just for women in general, or any kind of woman, right? If you're young, beautiful, buy this cream, it's going to eradicate all of your wrinkles. We're being sold on this idea that this is going to solve everything for us. So it makes sense that in trans community, what's going to be emphasized is also physical, right? Especially on top of that, when the physical for a lot is already a core issue, is already a core problem from which gender dysphoria stems. And I see so many people fall prey to that narrative. I see so many individuals fall prey to, it's like right now, this, I think, kind of a good parallel. As a lot of you know, weight loss industry is always up and down, always trying to sell us something. Right now, Ozempic, right? That medicine that is people who don't necessarily medically need it are taking it just to lose weight. We're constantly looking for a fix out there, away from the inside, that is, we are hoping is going to fix how we feel here. But if a person is an emotional eater and they struggle with self-regulation and they struggle with acknowledging and sitting with their feelings instead of reaching out for food to feel that void, Ozempic is not going to fix it. Same thing with gender transition. The disalignment that people feel is not just physical, right? For all of you, this is not just physical. It is emotional. It is years and years of not being seen. It is years and years of not feeling loved, or feel like you've been loved, or feel like you're worthy of love. It is lack of perhaps even self-love and self-compassion. It's so many other things. It's just being able to feel content with yourself, feeling feeling feelings of not being in such turmoil and such internal battle within yourself. It transcends just the physical. Physical is, again, as I always say, is of course there, it's very important, but there's also so many other things, right? So very, very important not to overemphasize surgical. And again, I see today there's so much overemphasizing on it. There's so much, especially in trans community, you're not this until you do this. And it's not well, no, it's not true. But we need to stop putting the physical, we need to stop putting surgical as the most important aspect. In fact, a lot of people, when they hear the word gender transition, surgical comes to mind and medical. Nobody talks about spiritual gender transition. Nobody talks about psychological gender transition. Why is that? Nobody talks about emotional gender transition. Nobody talks about so many other dimensions of gender transition. And when, of course, when there's so much emphasis on the surgical, I don't blame any of you to fall trap into it. But I also see how, in the end, that helps fix physical gender dysphoria. It helps alleviate the gender dysphoria. It helps you feel more affirmed and aligned. But again, you feeling more affirmed and aligned externally, the internal has to also match up. That's why a lot of people still feel void. And the void is going to be there unless you also do internal work. And that's why internal work is so important. So if you are starting your gender transition, broaden your concept and understanding what that implies. And allow yourself to acknowledge that the surgical may be important for you and you may decide to step into it. And like I said, I will support you 1000% if you decide to do that. But I caution you not to overemphasize it above everything else. And not presume that the end result of surgical is going to suddenly, like this rainbow, going to come up and dysphoria is going to completely go away. Yes, for a lot of people it does. For a lot of people it decreases drastically. For a lot of people, they now struggle with social dysphoria or with other aspects of dysphoria. So it's really important to approach your transition more as, I really like the word evolution, more as you are evolving as you go along. And with each evolvement, you are able to reevaluate and you're able to figure out for yourself what is your next step. Comment below, let me know if you feel like you're right now overemphasizing surgical transition. How do you feel about trans community also overemphasizing it? I know that I have a lot of people I work with who are so inundated with it, who are so tired of hearing it. It's very frustrating for a lot of you who, especially for, while you may want some surgical elements, you can't get them, again, financial, health, or otherwise. And when this narrative is keep being perpetuated, it's very exclusionary. And it's it defines only one particular set of experience versus so many different ones out there. So comment below, let me know. Love seeing your comments, and I will see you all next time. Goodbye.